Do you frequently have pain when you play golf? One of the more common types of golf injuries that we see is somebody who has or struggling with back pain. Usually the back pain occurs either on the back part of their swing or on the follow through. And the reason that is because we have these joints within our spine called facet joints. And they're meant to move backwards and close as we extend back and rotate. And they're meant to, when we bend forward, they're meant to open. Well, sometimes if you are golfing and you ramp up your golf activity, like say you went from golfing maybe once a week and doing 9 or 18 holes to maybe 3 or 4 times a week. And that increase in activity, if your body's not prepared for it, you'll start to irritate these joints and you'll start to get that pain at the end ranges of your swing. This is called facet joint syndrome. And we see this oftentimes with golfers. Some of the different things we do to treat this are we'll do some hands-on techniques where we'll open up that segment and stretch it out. And then there's also some things that you can do on your own to try and self-treat this. Oftentimes this does require management, and a couple exercises just are not enough to fix this problem. But here's a couple things we do with our clients. This exercise is a 4-way Superman. You're going to lift your arms and your legs. We're going to shoot for 3 sets of 10. This exercise is a cross-body rotation. You're going to bring your leg up and across your body. We're going to shoot for 3 sets of 15. The second common golf injury we're going to talk about today is hip impingement. So oftentimes golfers will experience pain in the front of their hips. Usually it's one side, but it can be both. A lot of this is dependent on your swing as well. So if you're swinging a golf club and you pull through just like this to get to the end of your swing, that end range of motion, you can either develop a little pinching here or sometimes a pinching here as well. Then when you follow through, you can develop that pinching, and that's usually on this back leg. Sometimes it's on the front, in the front leg. The problem with this is we don't have enough hip internal rotation. And because of that lack of hip mobility, we're just jamming into the hip joint over and over and over again, and we're creating this irritation. The pain is usually felt during the swing, but if it gets irritable enough, it can hurt with sitting for too long, it can hurt with driving, it can hurt with walking the golf course, so it can start to impact other areas of daily life. There's a couple things that we do to treat this. Again, this is another one of those conditions that oftentimes does require some management from a physical therapy standpoint to treat and get rid of it, but here's a couple things we do with our patients. You're just going to put a band around your ankles, you're going to keep your feet wide, and then you're going to take small side steps. This exercise, you're going to bring your knee towards your chest. You're going to get close to feeling pain, but you don't want to actually experience pain, and then you're going to come off of it. 3 sets of 10. The third common golf injury is golfer's elbow. So it's even named after golf because a lot of golfers experience this. So what exactly is it and how do you get it? Usually golfer's elbow doesn't really have a ton to do directly with swing mechanics or anything like that. It's usually due to how much golf you're playing. So again, it's an overuse injury, and it is a tendinitis or a tendinosis of this flexor tendon here at the elbow. So most people will feel it on the inside of the elbow. It can refer pain down into the forearm and sometimes even into the hand if it's irritable enough. The pain's usually located right around this bump. It's pretty uncomfortable. It will get worse with golf or any sort of gripping type of activities. It's usually calmed down by a combination of different types of medications, and then also in tandem physical therapy and managing the activity that you're doing or how much golf you're playing in this case, along with some different types of strengthening exercises. Here are some things that we do with our clients to help them improve upon their golfer's elbow. So this is a soft tissue technique that you can do to alleviate golfer's elbow. So you're going to come right on that bony part there, and you're just going to give a little bit of massage, and you're going to move your way down the arm, just like that, from that bony part. It's going to be a little bit tender, but don't overdo the pressure here. You just want it to feel a little uncomfortable, and that's it. Repeat for 3 to 4 sets of like 30 seconds to a minute. I know what you're thinking. Those biceps look huge. No, but really we're actually doing this exercise to treat golfer's elbow. So, as I told you, golfer's elbow is responsible for a tendinitis in the flexors of the forearm. So what we have to do is rebuild those. So you're going to take a dumbbell and you're just going to do a wrist curl. You want to keep this pain-free if you can. Fatigue is okay. You're shooting for 3 sets of about 10 to 15 repetitions. Again, what's more important here is trying to find the right weight that does not aggravate the symptoms that you can do that creates fatigue. The fourth and final common golf injury that we see is called shoulder impingement. So golfers will experience pain in the front of the shoulder here, and usually this does have to do with where you're ending or beginning your swing. So when you're lined up and you bring your arms back, when this arm goes across your body, it can create a little bit of shoulder impingement. So sometimes you'll feel it in the arm that is crossing your body, bringing it back. And then also when you follow through, you can feel it in the opposite arm. So depending on which arm you're feeling is where the impingement is happening. And usually it does correlate with a swing. Again, just like the other conditions, if you keep poking into it or you do a lot of golf, it will get more fired up. Shoulder impingement, basically what it means is there's an impingement that's happening within the shoulder, but there's a number of different places or objects that could be impinged. You have 4 different rotator cuff tendons, each of which can be impinged. So there's different types of shoulder impingement, but that goes beyond the scope of this video. Some of the different exercises that we do to treat shoulder impingement are, check these out. So this exercise is a side-lying external rotation. The goal of this is to load up some of the rotator cuff muscles to build them up and normalize your shoulder motion. So when you get into those different icky places, then you don't experience the pain that you're typically getting in your swing. You're going to repeat for 3 sets till you're tired. Find a weight that is pain-free doing this. Thanks for checking out our YouTube video. If you like the kind of content that we're producing and you feel like it's helpful, please click the link below and subscribe to this video. If you're struggling with pain or any sort of problem, performance issues, feel free to reach out. You can go to our website at p3physio.com, or you can schedule a call with one of our doctors by clicking the link on the website.